Hello, my name is Cinthia, and my poster is about the radiographic verification of the efficacy of autogenous dentin graft for alveolar preservation post-extraction as a potential material for new bone formation due to osteoinductive and osteoconductive properties, and because its composition is similar than bone, being appropriate for bone regeneration. For this research were selected 20 dental sockets of incisor teeth from 7 patients who were treated in the School of Dentistry at Federico Henríquez y Carvajal Universidad in the second semester of 2020. The patients were divided into 2 groups. The study group consisted of 10 sockets treated with autogenous dentin graft post in a trauma restriction, and the control group of 10 sockets that did not receive any biomaterial. In the surgical phase, first, a trauma restriction of all the dental pieces was performed. After that, every tooth were cleaned of all cavities, soft tissues, and gutta percha, and taken to be particulated and filtered in the Cometa Bio Smart Dental Grinder machine until obtaining a dentin graft. Then, all pieces were conditioned with alcohol and sterile saline solution. Finally, the particulated dentin was placed inside each alveolus, followed by the placement of a membrane and suturing of the wound. 16 weeks later, the tomographic results were obtained. The horizontal loss in the control group was 2.17 millimeters and 1.92 millimeters in the study group. In the vertical loss, there was a bone reduction of 3.22 millimeters, and in the control group, 2.16 millimeters for the study group. With this result, we can conclude that the dimensional reduction after extraction in the dentin group was lower than the control group after 16 weeks, both vertically and horizontally. Therefore, the autogenous dentin is a promising material that can be used in the alveolar preservation technique. We recommend further studies to continue this line of research for more accurate results.